Welcome back to Straight Talking. Thank you so much for joining us. And today, breastfeeding. You see here a knitted nipple, which is used to help mums, and we couldn't get a real baby, which is very disappointing. But I have got real experts. We've got Amanda, who is, and I looked at this is such a long title, International Board Certified lactating consultant.
Not lactating. No, I'm not lactating. I'm not lactating.
That'd be great TV though.
I'm lactating.
Yeah, and this young lady here, Lisa, who is lactating. So we've discussed that the levels are low. What's the percentage? Say, if we just take one city, take Sunderland. What are the percentage of breastfeeding mums there?
Last year, there was about 60%, around 60%.
That sounds quite good.
Initiated breastfeeding. That is the first baby's feed, one feed.
Right.
Okay. By around 6 weeks, the figures drop to the low 20s.
Why do you think it is then that there is such a quick drop-off?
Well, in Sunderland, you do get an awful lot of support for breastfeeding from the midwives, but also we have a dedicated breastfeeding team.
And you're on that team?
Yes, I'm on that team. There's fantastic girls. And we also have 12 peer support groups, so mums who have breastfed that have been given a 10-week breastfeeding course to support other mums.
Are they the bosom buddies?
Yes, the bosom buddies. In Sunderland, we've got the bosom buddies. Gateshead's also bosom buddies. County Durham's Baby Cafe, Newcastle and North Tyneside also got breastfeeding groups, just in the Shore Start buildings.
But with all the support then, why does it drop off so quickly?
I feel that it's about unrealistic expectations about what babies actually do. For the first few weeks, babies are going to want to feed an awful lot at night time. They are probably not going to sleep very much during the night time. They are probably not wanting to be put down in a Moses basket. And we can borrow the baby.
Just take the baby.
We can have babies that have fed and gone to sleep in your arms and are out cold. You know, the one where you with their arms. The minute you go, baby's wide awake.
Yeah.
And then rooting around for some more food. So mums then feel
comfort.
Yes, but they're not I don't think mums realise, and I don't think society as a whole stresses how much that baby wants to be with mummy and wants to listen to that heartbeat, because all they've heard is that heartbeat, and anything else they get scared and cry.
In terms of mums that can't manage it and that find it very difficult, do you think there's too much pressure on them? Do you think so, Lisa? Or
yes and no, because you can put pressure on yourself. The pressure doesn't have to come from an outside source. But there is lots of information about why breastfeeding is better, but you don't get any information on what it's actually going to be like. And then your expectations are that this baby's going to feed every 4 hours and sleep through the night from a week old and stuff like that, and it's not realistic. And so that's where I think the pressure comes from, just not knowing what to expect.
And from yourself, do you think some mums, you know, they can end up, I know some mums that have been really quite depressed because they've felt, you know, that they've become persona non grata because they're not breastfeeding, you know.
I actually feel that that's something that is portrayed in the media. There is according to the media, a big war between breastfeeders and formula feeders. At the end of the day, we're all mothers. We're all trying to do the best that we can for our babies, and nobody's going to say that they aren't.
The first feed idea, I think, is really interesting because I'd never heard of that before. So is this an NHS initiative just up here in the North East?
I think it's pretty much national.
And is it just that midwives encourage mums for the very first feed?
Yes. I mean, giving the colostrum will actually protect the baby's system and give them like their first injections, essentially.
So the colostrum, explain for people that don't understand what that is.
Colostrum is the first milk that you produce. You produce it towards maybe 32 weeks of pregnancy. Some mums will actually leak a little bit of colostrum before they have their baby. And this is a very protein-rich liquid that is jam-packed full of antibodies, and essentially you are giving your baby its first immunisations just by letting it have one feed.
And it's bright orange and it stains your bras.
Mine was yellow. You can have straw colour, it can be creamy, it tends to be, we talk of it in terms of liquid gold.
Yeah.
But it can be an amazing array of different colours.
In terms of the support then, because obviously that makes a massive difference, do you think there's enough out there for young mums as well? I mean, in terms of teenagers' pregnancies, is there enough support out there?
I think there is, yes. We've got, every breastfeeding woman in Sunderland gets a telephone number. If you've got a question, ring us.
So you can't latch on right.
Antenatally, there's lots of support. Postnatally, there's lots of support. Antenatally, so when people are making the decision how they're going to feed, they could do, for me anyway, I think there should be more support. I went onto a breastfeeding workshop as suggested by the health visitor when she came to visit me towards the end of my first pregnancy, and I was the only person there.
The only person?
I was the only person there. So, because the information that workshop existed hadn't been conveyed to other pregnant mothers in the area.
But then once you're a big advocate of breastfeeding, and so do you support other mums as well, Lisa?
I was a staunch visitor to the breastfeeding support group when both Evan was a baby, right through his feeding, right through in pregnancy with Connie. Trying to go to a breastfeeding support group with a toddler and a baby, a bit more difficult. But yeah, I do try. And when people, the more you're seen out and about feeding, people will just off the cuff ask you a question. And be it an older lady saying, "Oh, it's so lovely to see a baby being fed these days. You don't see it," and or it could just be someone who feels the need to cover up with one of those blanket baby, what are they called? Butterflies, aren't they? The baby covers. People who are feeling ashamed, not ashamed, that's the wrong word, embarrassed to feed in public. If they see someone feeding in public, maybe next time they won't feel the need that they have to cover up. And
do you think it just needs to be more normalised then?
Definitely.
What about celebrities? Do you think they do good in terms of posting the pictures? We've seen Holly Willoughby. I want to call her Holly Willoughby. Holly Willoughby. You see Holly Willoughby feeding, and do you think celebrities can be good role models?
I think they can. Yes.
Yeah.
Yes.
And I mean, I was quite shocked when I was researching the topic that Facebook. I had no idea, but Facebook actually take down pictures of breastfeeding women, and yet clearly they'll allow quite pornographic images up there. So that can't do anything to help the cause, can it?
I think when that does happen, and it doesn't happen so much now because of the furore that occurred when they first started doing it, I think it makes more women actually want to post pictures of them feeding their babies on Facebook. There was a big...
We just post them in our private closed groups instead.
But it shouldn't have to be a private
it shouldn't have to be. No.
Do you think there needs to be more in terms of from shops and restaurants and shopping malls and all those things? Should there be more feeding areas? Or what would you say to that, Lisa, or not?
I don't think it's necessary. The Metro Centre, local venue, there's seats all through the I don't know what they call them.
Malls.
The malls,
I believe.
Yes. There's lovely comfy seats all the way up and down there. Most shops have got a little seat by the changing area. Most shops have got little seats by the door. There's loads of places to sit and feed. You don't have to be in a room next to a smelly nappy bin in order to feed your baby. You can sit anywhere.
Do you think
I don't even sit. I use a sling and
Hoover, make a chili.
Well.
Do you think though that there are, for some mums that are not finding it easy, because babies can get distracted when they're feeding, that actually a nice quiet area and to just feel quite calm. If you're struggling with it and you're a first-time breastfeeder, do you think quiet and calm?
If you're struggling with it, you need the support to build up your confidence. So if baby's not latching on, you need to say, help me. You need to ask your health professionals or your volunteer breastfeeding organisations for some support, and you will get it if
So
you ask.
if they're not latching on, if you're feeling stressed by it, try not to give up at the first hurdle, because there are people there that would be very, very happy to give you help and give you support.
Take telephone calls 10 o'clock at night.
Yes, from me. when my second child was little.
So go out and get advice, and don't be afraid to talk, and don't be afraid to ask for support.
Yeah, even if one health professional is saying to you that everything looks fine, if it hurts, then it's not fine.
It should
okay?
never
It
hurt.
shouldn't hurt.
It shouldn't
Never.
hurt. So keep on shouting until you get the right support for you. There may be certain issues that can be easily fixed. There is a lot of support out there, both on the internet, in Facebook groups, and also in the areas with your health professionals and your peer support groups. Just ask for help.
And if you see a breastfeeding mum and you've got a question, ask her.
Yeah, ask. So let's talk more, let's all support each other, and possibly knit more of these, because that's just made my day. Amanda, thank you so much for coming in.
You're welcome.
Lisa, thank you for coming
Welcome.
in. And thank you so much at home for watching Straight Talking, as ever. If you've got any comments at all, straighttalking@maidentownandweir.tv is our email address. You can also follow us on Twitter, and we'd love to hear from you. Thank you very much for watching Straight Talking today.